Welcome, Dr. Kalptaru Kishlay. It's a pleasure to have you on our today's episode. You are one of the most respected prosthodontist and implant specialists in the region, and our listener would love to know what inspired you to choose this specialization.
Thank you so much, Dr. Parijat. My journey began with a desire to restore smiles and function, not just to fill spaces but to rebuild confidence. Prosthodontics allows me to blend art and science, and implants gave me a way to provide truly permanent, life changing solutions for my patients.
So, Dr. Kishlay, implant dentistry has come a long way in recent years. How do you see the evolution from traditional implant techniques to the full digital workflow we use today?
Yeah, it's been a quite a journey. It's been actually revolutionary. Earlier, everything relied on manual planning with 2D X-rays. Nowadays, we do CBCT, intraoral scanning, and computer-guided surgery. And we can plan every implant with 3D precision, improving accuracy, safety, and predictability. Digital dentistry has become made implants faster and more comfortable for the patients.
So, Dr. Kishlay, when a patient comes to you with a missing tooth or multiple missing teeth, how do you decide between single implants, all on four, or full arch rehabilitation?
Yeah, that's a very important question of yours. It begins with diagnostics, CBCT for bone quality, intraoral scans for occlusion, and patient expectations. A single implant works great for isolated tooth loss, but when multiple teeth or an entire arch is to be replaced, we go for all on 4 or all on 6. It is a customized patient specific approach which can even support the immediate loading.
Okay. So, at our clinic, we rely heavily on digital scanners, CBCT, and 3D printing. How do you feel dental technology has transformed prosthodontics and implantology?
Yeah, completely. Actually, digital technology has eliminated guesswork. Surgical guides designed on digital scans ensure perfect implant positioning. Chairside CAD-CAM and 3D printing help us deliver provisionals the same day. The precision and the patient comfort are incomparable to the old conventional methods.
So, being an orthodontist, I often collaborate with you as a prosthodontist on implant related cases. How important do you think ortho prostho teamwork is for long term success?
Actually, Dr. Payat, I think it's a win-win situation for us and it's very crucial. Orthodontic pre-alignment creates proper space, angulation, and bone support for implants. If we skip that step, prosthetics can look compromised. When orthodontist and prosthodontist work together, the end result is both functional and aesthetically superior.
So, what are the common myths or misconceptions patients have about dental implants?
Actually, in Bihar or in our region, the misconceptions are very much. The most common one is implants are very painful and expensive.
Yeah,
In reality,
right.
modern implant surgeries are minimal, invasive, and often painless. And when you consider longevity, implants are actually more cost effective than bridges and dentures. Another myth is that implants don't last.
Yeah.
With proper care, they can last a lifetime.
So, now coming to the topic of material choice and aesthetic. Today, we have so many prosthetic materials like zirconia, E-Max, hybrid ceramics. How do you select the right one for each case?
Actually, the choice of material is very important in implant dentistry. Material choice depends on strength, aesthetics, and location. Zirconia is best for posterior loading areas, Emax for anti-aesthetics, and hybrids for full arch restorations, where shock absorption is vital. The key is balancing beauty with biomechanics.
Now we are coming to the topic of the future of implantology. So, Dr. Kishlay, I want to know where do you see the future of implantology going in the next decades?
Actually, if you ask me, I would say implant is the future. And the future is fully digital and AI driven, from AI assisted planning to robotic guided surgeries. Same day implants with chairside prosthetic design will become routine. Also, advancements in biomaterials and surface coatings will enhance osseointegration and reduce the healing time dramatically.
So, Dr. Kishlay, can you share a patient story that really made you feel proud of your work?
Actually, I remember one of my patients. Uh, she was middle-aged lady who lost all of her teeth, upper teeth, after an accident. We rehabilitated her with full arch implants and zirconia prosthetics. When she saw herself smiling again for the first time, she actually cried. That emotion, seeing confidence return, is the biggest reward for my dentistry.
Yeah, really. That is a very emotional moment.
Yeah.
For the patient and doctor also.
Yeah.
Yeah. That's truly inspiring, Dr. Kalptaru. Before we close, what advice you give to young dentists who want to specialize in prosthodontics or implantology?
Yeah, actually, nowadays everyone wants to place implants, and that's quite encouraging also. But we should focus on fundamentals, occlusion, soft tissue biology of the patient, and patient communication is very important. Technology can amplify your skills but can't replace understanding. So, continuous learning, stay ethical, and remember every restoration you do represents you for years to come.
Beautifully said. Thank you, Dr. Kalptaru Kishlay,
Thank you so much.
for sharing such valuable insights. I'm sure our listeners have gained a deeper appreciation for the science and artistry behind implant dentistry.
Thank you, Dr. Parijat. It was really pleasure discussing this topic with you.
And to everyone listening, keep smiling and keep learning. This is Dr. Parijat Pallav signing off from Balaji Dental and Orthodontic Clinic, Patna.